She was 74. Her bone density actually is at the level of a 20-year-old. Because of the muscle bulks and because of the strength of the bone that she has, she was able to walk without a walking stick at 1 week after the surgery.
The first surgery, she kind of went on it on her own. The recovery was not as great. Before the second one, she wanted to get my help to really dial in the diet, make sure that her habits of like exercising, and she saw the difference in the second surgery compared to the first one. Her recovery was faster.
Dr. Khairul Anwar bin Ayob, consultant orthopedic and arthroplasty surgeon at Subang Jaya Medical Centre and Ara Damansara Medical Centre. Dr. Khairul completed his postgraduate specialization in orthopedics from the University of Malaya and further subspecialty training in lower limb arthroplasty and reconstruction surgeries in Chonam National University Hospital, Korea and the Gold Coast Centre for Bone and Joint Surgeries. Adele Wong, dietitian and founder of Nutrition Track, having done her Masters of Nutrition and Dietetics from the University of Sydney, she provides evidence-based nutrition education to the public and her clients with special interest in women's health and sports. By 2030, Malaysia is expecting to be an aging nation where 15% of the population will be aged 60 and above. This shift is expected to increase the burden of our healthcare system where age-related diseases become more prevalent. Hi, my name is Leonard and welcome to Let's Talk About, a health podcast by SJMC. And today let's talk about the aging population, why exercise is necessary, and how do we start. Joining me today is Dr. Khairul and Adele. Welcome to the podcast.
Pleasure to be here.
Thanks for having us.
So let's get started with our first segment, which is why is today's conversation so important? And I'd like to start with a personal story of mine. So around 10 years ago, my late grandma unfortunately had a fall that caused a hip fracture. Yeah. So she was going to the toilet, and at the age of 80 plus, she had some mobility issues. She slipped, she fell, fractured the hip, went to the hospital, and for lack of better words, she then subsequently developed pneumonia and subsequently passed on. Is that something very common amidst the aging population? And is that the only call for concern among the aging population?
All right. Your situation with your grandmother is quite unfortunate, and unfortunately, we do see a lot more hip fractures in the elderly. And that's because we are entering into an aging society, and there is good evidence that when a patient actually falls and breaks their hip, their risk of actually dying in the next 2 years is 50%. And that's why as a medical society, we are pushing for patients to not be immobilized for too long. So that's why doctors aggressively now suggest to do surgery and get the patients on their feet or at least on the wheelchair as fast as possible. This is because the patient's physiological reserve is already low. As they get older, they get frail. And when they don't move, it's a start of a fall of a domino, which can lead to multiple different complications, which we call fracture disease. So patients who don't move, they get complications such as lung infections, urine infections, they get deep venous thromboembolism. All this can actually contribute to a vicious cycle, which might eventually end up in death.
Right. So I want to kind of like focus in on frailty, right? And I've got two questions here. When does frailty start and how do we define frailty? Would anybody like to start?
Okay, so frailty actually starts as someone's age, and I think basically you can start to say that someone's age above the age of 60, and there's 3 different types of frailty, and there are different definitions of frailty. So the 3 different types is physical frailty, and one of the ways we measure that is by sarcopenia. And also osteoporosis. The second type of frailty is basically mental frailty. So patients who are getting more memory loss and needs a bit more time to actually compute stuff. They are basically considered mentally frail. And the last one is social frailty. So patients who don't get enough socialization actually starts to deteriorate in the other 2 different segments as well. So those 3 things is what one is the things which we need to focus on to prevent the elderly population from going down this vicious cycle.
Right. You know, Adele, you work with clients who present themselves with concerns on their lifestyle. At those stages already, is there anything related to our population when it comes to their lifestyle that contributes to frailty?
Yeah, definitely. So I mean, as we age, we will lose bone mass and muscle mass, right? Gradually. And I think what I see a lot is lifestyle change, especially when they enter the working world. They're either chasing careers or they have other goals and they become more sedentary or their social circles have changed. So essentially, what happens is all in all, it contributes to them either eating more or moving a lot less. And I think that really speeds up the process. We can't stop aging, but we can definitely slow it down by eating well, exercising. And yeah, so that's what I see mainly in what happens in the population.
You know, you talk about this change in lifestyle as from the point of us going into the job market for that matter. How early can frailty begin actually? Is it something that starts only when you're 50 and above? Or is that something that happens way earlier?
That's a very good question. Essentially, we don't really know when frailty actually starts, but I guess with every chronic disease you are diagnosed with, the risk of your physiological capacity to decrease increases. We know as you age, our physiological reserve basically reduces, and I guess a good age to actually start to assess whether someone is frail or not is 60. But obviously, if the patient has a lot of chronic diseases, it should start earlier as well.
You mentioned chronic diseases.
Yeah.
What are some of these chronic diseases?
In our population now, the chronic diseases which is most common is metabolic diseases, so high blood pressure, diabetes, hypercholesterolemia. So those are the big three metabolic diseases, which basically is influenced by our poor diet and our lack of a healthy sedentary lifestyle.
Right. So high blood pressure, high cholesterol, high blood sugar, right?
Yep.
You know, when you deal with clients in that space with these conditions, for example, right? Do you see their mobility being limited already at that stage when they first come to you?
Yes, because actually, and the sad thing is the age is actually getting younger as even in their 20s and early 30s, they're already seeing some sort of high blood pressure, some sort of cholesterol, some sort of type 2 diabetes. And a lot of it is also linked to body composition, having more fat versus muscle mass. And that definitely is an issue. And yeah, it's already a problem at that stage, right? So it would definitely worsen as someone aged.
But for, let's say, women, for example, we hear stories about bone health and things like that. Are women more at risk of certain conditions? And is there anything that you're seeing within the female population that female listeners should be aware of?
I think generally speaking, women tend to have more risk of osteoporosis and also sarcopenia. So especially after menopause, right? I think the rate is somewhere between 10% more in the 5 to 7 years after menopause. And I think, yeah, so that is one problem as well. And I think what contributes to that is also, generally speaking, women tend to have a lot of dieting behaviors in the early 20s, meaning they're not fueling enough. And on top of that, I think there's a lot of misinformation, misguided information as well when it comes to women and exercise. So there's a lot of barriers in the sense that women are not allowed to do this, women are not allowed to do that. So then they think like, oh, what am I supposed to do? And then they end up not doing anything. So I think that's one of the contributors as well. And I think just in general, as people age, we do also tend to be a bit more sedentary. We don't think about like strength training as much. So yeah, so I think these are contributing factors.
Dr. Khairul, you know, talking about people who exercise and then have good outcomes, for example, do you have any personal patient stories that have demonstrated that outcome?
Yep. So one patient which is very striking to me, and I still remember her case until now, is a very active patient. Because of her activity, her knees actually wore out quite fast. But even with the worn out knees, she's able to hike through Antarctica. And when she came to me, the knees are quite bad, but we actually checked her bone density, and her bone density actually is at the level of a 20-year-old. So that was quite surprising to me. And when we did the surgery as well, we can see that the muscle bulk which we had to go through is actually very, very, very big. And we did struggle a bit through the surgery, but because of the muscle bulk that she has and because of the strength of the bone that she has, she recovered very, very fast, and she was able to walk without a walking stick at 1 week after the surgery. So yeah, that was very striking to me. And also I think because of her mentality, she's very motivated to recover, along with the very good physiological reserve. I think that made quite a difference in terms of her recovery.
How old was she?
She was 74.
Oh, wow. So, a 74-year-old with the bone health of a 20-year-old.
Yeah.
All right, wonderful. So, clearly, it's never too late. Working out and giving a little bit of strength training can even impact some prognosis and benefit as short as 2 weeks before a procedure.
Yep. And I also feel like I need to re-emphasize on the mentality. So the motivation to actually recover is a very strong predictor of how you actually go through the recovery process.
Well, when we talk about frailty in this question and the burden that it brings, I remember back then in my grandmother's days, we were obviously in a situation where we were also expending a lot of resources, both financially, time and effort. And apparently from local statistics, that seems to have grown over the last 10 years and is expected to grow even further. So then the question really comes, right? Why aren't we able to pick up more of these cases earlier? And why aren't we able to do something about it before it becomes to that point? Yeah. What do you guys think?
So yeah, I think that's a good point. I mean, 10 years ago, the level of awareness which we have probably is not as good as what we have now. So there is a movement towards people getting more healthy lifestyle. There is a movement now towards diagnosing the metabolic diseases a bit earlier. And I think we are moving in the right direction. So I think this podcast is one of the efforts for us to actually increase the amount of awareness which we spread to the Malaysian population, so they actually are triggered to actually come and screen their health and at least know a bit about what their body is like, and if there are anything or any interventions which can be performed earlier on, then that's a very, at least we did a good thing.
Yeah, but when it comes to frailty specifically though, why aren't we able to pick up them sooner than later? Like, we tend to see statistics of late stage osteoarthritis where the cartilage is gone, there's very limited mobility, right? Why is that the case?
I guess that's to do with the Malaysian mentality. I do have to say that Malaysians, they are very resilient and they also tend to bear their own burdens by themselves. They don't tell their family members. And that's why when they actually present to my clinic, they are already at a very late stage. So when they come in a very late stage, most of the time the treatment which I can recommend or advise is already very, very aggressive, as in surgery. So yeah, I guess the awareness now is that when you see a doctor, it does not always mean you need a surgery. So at even an earlier stage, you can actually start getting advice on how to do physical therapy, how you can actually change your diet. And I myself am a very strong advocate of exercise. So that's most of my patients, I will advise them to go through exercise. And sometimes by improving their lifestyle, they can actually slow down the aging process.
So I want to just wrap this segment very quickly on this last point then. So what are some good examples of people doing the exact opposite, where they screen early, they are physically active as they age? What kind of benefits can we share with people?
So I do actually have one client who had 2 foot surgeries in the span of 8 months. The first surgery, she kind of went on it on her own per se, but she saw how the recovery was not as great. So before the second one, she wanted to get my help to really dial in the diet, to make sure that her habits of like exercising and everything, or rather just moving, is there. And she saw the difference in the second surgery compared to the first one. Her recovery was faster. She also said she bounced back to like exercise pretty quickly after that, when she was cleared to move, because she was non-weight bearing for a while. And yeah, so there was a clear difference there.
What were some of the changes that you recommended to her that she did?
Essentially putting in a structure in terms of eating well, making sure that the basics are there, enough carbohydrates, enough protein, enough dairy, your fruits and vegetables, all the components there. And then also trying to build in a routine of, I don't teach her exercise, but just advising her, okay, in what days can she do certain exercises and how can she keep active, and it's essentially just a structure.
Was there like a predominance towards strength training or cardio?
She personally prefers strength training, so there was a lot more strength training. And then later on, when she was cleared for weight-bearing movements, she added in cardio as well.
Right. So right now, is she doing cardio and doing strength training?
Yeah, strength numbers also increasing.
Wonderful.
She's doing really well.
And Dr. Khairul, when you see patients, for example, right, is there a difference if they exercise and versus they
I
don't?
do like that example of comparing two different surgeries. So one surgery, actually, they were not sort of prepared and they weren't, they just went with it. Whereas the second surgery, they came in a bit more prepared. So there's very, very good evidence that well, actually, surgery is actually an insult. When I do surgery to patient, I cause injury. So patients need to recover. So there's very good evidence that if the reserve is higher before the surgery, they tend to recover faster. So yeah, high protein diet, actually increasing your amount of muscle can actually improve the outcomes after surgery. One thing I think which people tend to ignore as well is the glucose intolerance. So patients who are at pre-diabetes, if they go through a healthy lifestyle, they can actually improve their glucose tolerance. And we know that if patient has high blood sugar after surgery, they have a higher chance of getting an infection or surgery complication. So I think it's very important to sort of push that towards our population, that we can improve glucose tolerance with a proper good lifestyle.
Right. And so you mentioned blood sugars. And so my question now to both of you is, when it comes to results, let's say somebody's slated for a surgery or a procedure, how soon can strength training or a change in any of these behaviors benefit someone slated for a surgery? Is this something that they must invest in a year before the surgery? Or could it be something much more faster?
I guess it's never too late to start anything. Yeah, and sometimes I would say that if, let's say, a surgery is scheduled, I would say that's a good opportunity to start picking things up, to start putting in the habits, because there's more motivation per se. So you leverage on that. You use that as your motivation, and then you start putting in, I would say, more aggressive lifestyle changes. And then of course after that, the goal is to wanting to build that and prolong that,
right,
long term.
Right.
Myself, so I think, like I said, it's never too late to start. Obviously, when a patient comes to me for surgery, if I list them up 2 weeks from now, they can always start now itself. Get a very good protein diet. I will refer the patients for physiotherapy, and they can start the strengthening and range of motion exercises even before the surgery. And at least when patients go through the recovery process, they already know what to do. So it's a lot better for them, I see.
Right. So it's really never too late to get started, and even 2 weeks can yield quite significant benefits for a procedure, for example. So, we speak about frailty. So I want to zoom in a bit on exercise, but more specifically the fear of exercise. And I say this from personal reasons as well. It took me 6 years to convince my mom to do a squat, right? And there's this perhaps artificial fear, I guess, to those uninitiated, right?
Yep.
Where you see all these videos online, especially among the elderly, of people bounded to wheelchairs, or they fall and risk hip fractures and things like that. How valid is this fear, and is this something that should put people bounded to their chairs and not exercise?
Yep, obviously it makes sense, right? If you don't move and you don't exercise, you won't get injured. But the thing is, if you don't stress your own body, you cannot improve, and your body is essentially a very dynamic thing. So it tends to respond to what stress we put through it. And like I mentioned before, I'm a very strong advocate of exercise, because I know exercise actually improves a lot of different systems in your body. It improves your musculoskeletal system, it improves your insulin sensitivity, it improves your cardiovascular system. So the key about exercising for me as a doctor is that you need to start safe and supervised exercise so that you know what your baseline is, and you can slowly increase every day 1%, 1%, 1%. So once you know what your baseline is like, then it's always easier for you to institute a safe exercise program, and this can basically be the beginning of a healthy lifestyle and also prevention towards getting these chronic diseases.
Right. You know, talking about fears, when you work with a general population, whether it's female, male, doesn't matter, right? Or perhaps maybe fear is not the right word. Misinformations. Is that blocking certain people from correct exercise or exercising for that matter?
Absolutely. So, especially very, very popular among women, the fear of strength training or the misinformation that women cannot lift too heavy, and even cardio. Like, we're not allowed to do too much cardio because otherwise it's too stressful.
Then you do nothing.
Then you spike your cortisol, and then everything goes downhill. And so again, people end up not doing anything. Yeah.
Right. Devil's advocate, right? How do you get injured then when you exercise? Because technically, you rightfully pointed out, if you don't exercise, you don't have a risk of getting injured, right?
Yeah.
But how do people get injuries in the first place? And I want to say this so that people understand what to look out for so that they don't get injured.
Okay, so injury basically happens because you're unlucky. That's basically it. So that's the main thing. But the things which you can start doing to sort of reduce your risk of getting an injury is basically do a lot of warm-ups. You stretch before you do your exercise. You do a lot of balancing exercises, proprioceptive. You need the brain to joint communication. So once you know where your body position is like and you are in tune with your body position sense, you get a less risk of injury. But obviously, nothing is 100%, right? There's always a small risk of getting injuries. So those people who feel like their injury risk are a lot higher, they can basically do exercises which is lower impact and also less stressful on the joints, such as hydrotherapy. So hydrotherapy, I find, is quite enjoyable, especially in the elderly population. My mom does it, and she does it with a lot of her friends, and they make sort of like a small party out of it. So when you do hydrotherapy, there's significantly less risk of getting injuries, but at the same time, you actually work your muscles harder.
Right.
I think to add on to that is also what I see a lot is a lot of people just jumping from 0 to 100. So not allowing their body to adapt accordingly. And then they blame the exercise, there's something wrong with the exercise. But no, it's actually you are either doing it wrong, you're not increasing gradually, or you're under-recovered, meaning you're not sleeping well, not eating well, and that affects your adaptation as well.
Yep.
And our bodies are really highly adaptable, right? There's no such thing as too much. It's about building up according to where you're at, up to the level, to whatever level you want, essentially.
So at the end of the day, touch wood lah, it's a bit unlucky if you get injury. Maybe you need to siram air limau ke apa, right? But in the general population then, right, when people are sort of having that minor motivation to get started, where should people sort of start in terms of exercise? You mentioned about modification and tailoring it, but what is that starting point for most people that you guys would recommend?
I would say they can start with an activity or exercise that they enjoy, and then adding in some sort of cardio or strength. And from there, actually, what I normally tell people is you can either join groups, small PT groups, or even get a personal trainer to help you as in the initial stage so that kind of know what to do. And then from there, you can then join bigger group classes, even run clubs.
So I think this is where you start to leverage the social part of the exercise. So when you find a buddy, at least one, it's always more enjoyable. And it's always good to interact with someone and basically you challenge each other. Obviously, sometimes you can take this to a very too extreme and you get injured in the process. But yeah, that's why you need to find someone who is at par at your level, and you do it like I mentioned before. My mom, she goes with people her own age and they go to this hydrotherapy with a personal trainer who actually supervises their hydrotherapy, and they make a bit of a party out of it. They dance inside the pool and all that, so that actually improves their muscle strength, but at the same time they have a lower risk of getting injuries, and because it's enjoyable, they actually look forward to the next session.
Right. But functionally speaking, right, is there a minimum threshold amount of exercise that is needed for you to get some form of benefits?
Something's better than nothing.
Yeah, so as long as you start somewhere and it's dynamic, you progressively get better every single day. Even 30 minutes of exercise, I think, will benefit your body. And I think there are talks about this exercise snacks.
Oh yeah.
So exercise snacks is being Malaysians, we like to snack on food and all that, right? So instead of makan the kacang or the chips, you actually stop what you're doing and go do a jumping jacks for about 15 to 30 seconds. That's good enough. And that I mean, if you do that every single day, your body will thank you for it.
So don't makan the snack, makan the push-up.
Yes.
Okay, so certainly anything is better than nothing, right? But I want to draw on that example you just gave there, which is the fact that sometimes there's this kiasuness inside each of us in group classes or run clubs or whatever, and touch wood, you get injured. Or maybe you went to that spinning class, you didn't realize the music is just overwhelming your sense of tiredness and you just go for it and then you get rhabdo, right? Right? We hear stories about that.
Yeah.
But for people who unfortunately get injured, right? How do you then get out of injury and then get back safely to exercise?
So yeah, it's always good for you to sort of get some guidance or direction to start back the exercise regime. Obviously, when you get back from injury, it's always not a good idea to start where you were before the injury. We should actually start from zero and slowly progress, because you need to test the tissue which has been injured and you don't want to re-injure it. So that's one of the problems which I see with athletes. They think that they are starting right before where they get injured, and they tend to get re-injuries, and that can be quite frustrating.
Right. So, but that's for athletes, right? And I was just reading up that there are some injuries that might be reversible and so on and so forth. Especially for the non-athletic population, right?
Yeah.
How should one deal with injuries in that sense? Because it can be quite demotivating, right?
So I think as long as you get a diagnosis, you know what your injury is, you need to talk to your doctor on how to actually safely start back your exercise. You need to basically communicate, because if the doctor doesn't know what you actually want to do, sometimes it's difficult for them to actually advise you on what to do. And once the doctor has given you a clearance, it's always a good idea to find yourself a trainer or a physiotherapist which can actually guide you on how to get back the strength, the balancing properties, and also the range or motion of the joint, so that you can at least get the scar tissue to what level it was before the injury.
Right. And would you say most injuries these days are reversible, or are there injuries that are sort of like debilitating these days?
Obviously, the most common injuries which we get in the knee, ACL, is actually not reversible because unfortunately, because of the position of the ligament, it doesn't heal by itself. So that's why we do a lot of ACL reconstructions. But most other ligaments around the knee or the ankle or the hip are, I wouldn't say reversible, they can heal by itself, and the scar tissue can actually regain at least 98 to 99% of the strength. So there are certain injuries which are a bit more difficult to recover from, but most injuries, I feel like if you rest properly and follow the doctor's orders, I think you can get back to your previous function with a bit of patience.
Yeah, patience is key. And speaking about patience during the recovery period, right? Does nutrition play a role in that?
Yes, of course. Yeah, so just making sure that their baseline diet is enough. And then, of course, you want to you want to prioritize certain nutrients a bit more. So things like protein, and then depending on what injury, things like your dairy products with the calcium, vitamin D's, all these are important nutrients to help the recovery process. And of course, all your fruits and vegetables, they're antioxidants, they're very anti-inflammatory as well. These are things that we want to prioritize during the recovery period.
Yep. On that note, for nutrition specifically, right? I read a report indicating that with women, especially, bone stress injury seems to be quite prevalent. What deficit does that come from, if any, from a nutrition standpoint?
Calories as a whole. And usually probably a lot less on the dairy. Again, bringing back to the early 20s, right? The dieting mindset. So one, they're cutting a lot of calories, and also they tend to cut a lot of dairy as well, because dairy in their mind is fattening or more fattening than other foods. And then I think at on top of that, some people would be over exercising in a sense that they're not fueling their body for that exercise. So that puts them in a greater deficit, and that puts them at a greater risk of bone stress injuries and injuries in general.
Right. So fuel yourself correctly before you exercise, and touch wood, if you do get injured, it's not the end of the world. You can recover from it, you can adapt to it, and you can get back on track. Does that sound about right?
Yep. So get a lot of help. There's always more information out there. So the world is not closed. You shouldn't go through your injury alone. Get as many opinions as you can from doctors, nutritionists, physical therapists, and hopefully with enough information, you can sort of outline a program on how you can get back to your previous function.
So before I wrap this section here today, right, for people listening and they want to get into exercise, the lifestyle change, is there any form of screening that can be done? And ultimately, as they join into exercise, is there a distribution of exercise that they should do?
So yeah, always good to actually engage a physical therapist. And like I mentioned before, you should find out what your baseline is. And actually, when you engage a physical therapist, they can do like a screening for your body and decide what sort of level you are. And from there, you can actually monitor your progress as you start your lifestyle change. And at the same time, I think the physical therapist can actually screen what are your capabilities before you start the exercises. What can you do before, and what you can do after, and how to actually start your lifestyle change in a safe manner.
Right. And when it comes to exercise recommendations, then is there a golden ratio of distributions?
No, like something is better than nothing.
Right.
Yeah.
But if people had to prioritize, where they should get started in terms of priorities?
In terms of exercise? Yeah, like I said, I always get them to pick an activity that they enjoy first. And if, let's say, they are really, really, really short on time, they had to choose, I would skew towards prioritizing strength training a bit more, and then throwing in the cardio on top of that.
Right. So if people want to get started today, get yourself screened and then look for exercises that they can do. I think the keyword here is sustainably into your lifestyle. But if you have to prioritize, it sounds like strength training might be slightly more beneficial to start with first. Be part of the conversation. Like and follow us if you want more health tips, or you can leave a comment to let us know which topic we should dive into next. Okay, so for this last segment, I guess I really want to talk about action steps, right? And I think the best way to think about it is pretend I'm a patient. Okay, so pretend I'm an old auntie, coming into your clinic today, and I'm going to ask you, hey, Dr. Khairul, I want to get started. Where and how should I start?
Okay, I guess the first step is always to decide what your baseline is like. If you're an old auntie, obviously you're menopausal, so it's always a good idea to actually check your bone density. So this can be done quite easily. It's basically a 10-minute test, and the results come back and shows you whether your bone density is good osteopenic or osteoporotic, and based on that, the doctor can institute a treatment regime to actually try and improve your bone density, because if you are osteoporotic, you are at higher risk of getting fractures. At the same time, also myself, I always decide what sort of physiological reserve patient has, so the amount of muscle they have and what their pre-morbid function is like. And based on that, then I can refer her to a physical therapist, and they can start outlining a lifestyle change program based on what we screen the patient beforehand. And that can also be used as a baseline and see how they respond to the lifestyle change, and we can actually track their improvement with the lifestyle. Yeah.
Right. So get myself screened, and based on the findings, then we calibrate and we structure a plan afterwards.
Yep.
Right. So then with that plan in mind, the way I eat seems to play a key role as well, right? So, in Malaysia, we are number one for obesity rates in the region, right? And I think when it comes to fruits and vegetable intake, I think something like a whopping 80% or more.
95.
95, there you go. I'm being polite. 95% of us don't eat enough fruits and vegetables, for example. As an old auntie, right? How should I build my food, my plate, my nutrition?
Same thing. We do an assessment first of where you are currently at. And then we see what is missing, what you're having more of, and then we build accordingly.
Right. What do typical aunties miss out in your experience?
I think sometimes it's also malnutrition in the sense that they're eating enough, but not enough of the right things. So the older population tends to shy away from protein foods.
Why do you think that's the case?
Either taste change, or they feel that protein is too filling. They feel like that they're kind of like indigestion feeling. And then so they think, oh, it's bad for me, and so I should eat less of it. And so they skew more towards plain oatmeals, plain porridge, soupy stuff that does not have
Yeah, I
protein.
see that a lot. So I think at least for the Chinese community, we see this love and affair for porridge. Like this big bowl of porridge, right? And you have very little protein-based items, and even vegetables for that matter. So for this auntie over here, if I want to then, as Dr. Khairul advised, I need to build muscle, build my bone density, right? What kind of nutrients should aunties like me prioritize then?
So really, we don't want to overhaul your diet. We're not changing like every single component. So you can stick to your normal porridge, but let's see how can we increase the protein intake. Can we add like shredded chicken inside? Can we add like some vegetables at the side?
Yep.
Or it doesn't even need to be a balance in that one meal. It could be another meal. Like, okay, so if let's say your porridge, not enough protein, okay, then your next meal or the meal before that, can it be more protein rich? And I think one of the simple ways as well that people tend to forget is that dairy is a really good source of protein as well. And it's very easy.
Yep.
A lot of old aunties, uncles, they drink a hot drink in the morning, like plain tea or black coffee. Sometimes I say the easiest thing is just put in some milk inside.
Yeah. You mentioned milk, and I think there's this affection with the aunties and the uncles sometimes to only buy certain milk from certain pharmacies, and they only want to bancho that kind of formula products, right? And now you're saying you can take normal milk. And to them, they're scared because they've heard of things like cholesterol with full fat milk, for example, dairy being inflammatory. Are those true?
No, absolutely not. Dairy is at best is neutral and definitely anti-inflammatory, in fact. So it's definitely something that old aunties and old uncles should have. If let's say you're worried about the fat content, then there's always low-fat options, which is just the full cream without the fat.
I think we should bring back the focus to vitamin D as well. So milk, a dairy product, is very high in vitamin D. And we know as Malaysians, Malaysians have 50% of Malaysians are actually vitamin D deficient. Despite us having very strong sunlight, we are vitamin D deficient, and that actually contributes to the sarcopenia, and it also contributes to the osteoporosis. Right. So dairy is always a good source of vitamin D. So let's not forget the vitamin D.
Right. So then for everyone listening, and especially the aunties and uncles, right? When it comes to then just building my food, what reference should they follow?
The Malaysian plate, the suku separuh, which is literally so easy, right? You fill half your plate with vegetables, a quarter with protein, another quarter with carbs. Just start with that.
Yep.
And it's one of the most underrated tools. It works. It really, really works. So if you're even just 2 meals, it's like that. It's a really good start.
Yep.
And then, you can build it to maybe 3 of your meals looking like that. And then, of course, there are small differences. If let's say someone is more active, then it kind of maybe just need a little bit more of the carb portion and just could be adjusted accordingly. But that is like the baseline plate that you can use.
So imagine this auntie here started working out, started strength training. How should that plate modify as I strength train? Is it a massive shift whereby I'm eating double the amount of chicken now, or how does that look like?
No, definitely not. I think again, depending on how much you're actually doing, right? But I think for an old auntie of that age, that is enough. The suku separuh will be enough. It'll be sufficient.
Right. So you don't have to have a massive overhaul, it sounds like. You basically can sort of like fortify and enhance your existing preferences. Porridge is fine. Just add more kaisi or chicken slices, right? And you don't be afraid with dairy. Dairy is okay. It's perfectly fine. But Dr. Khairul, coming back to you, right? If let's say auntie hears again, right, and does all of that changes, and now I'm strength training, right? How does this contribute back to when I see you again? What improvements am I going to look forward to? And what general benefits will I be seeing next?
So resistance training or strength training basically is enhancing the amount of muscle you have. So muscle is a bit like your brain. The more you use it, the more you get it. And the more muscle you have, it's always good because you actually enhance your circulatory system, you enhance your aerobic capacity, your lung capacity, and also improves your muscle. So when you come back and you say, Doctor, I've been doing strength training for the past 3 months, I think there's a very good chance that when we repeat your bone mineral density, it will improve. Sometimes there's also evidence that you have less joint pain or your osteoarthritis progresses slower. And also we can find that with increasing muscle bulk, your insulin resistance is actually lower. So those are actually the benefits which we find with patients who start a regular exercise regime.
Right. And in your practice, right, what are some of the interesting stories you see these days of people in that exact category?
So patients who are very motivated to exercise and improve, I find that they one thing is the insulin resistance. We always go back to that because patients, as you get obese, you get more insulin resistance. And one way we measure that is by the HbA1c. And patients who are very disciplined in doing the exercises, their HbA1c can actually improve. And actually their need for diabetic medication sometimes can be negated. They actually can stop. So that's one of the main things which we see. And the other thing is obviously the cholesterol levels. So as they exercise more, they increase their metabolic rate. So when your metabolic rate increases, you actually burn more energy, and the amount of fat which you actually store becomes less, and your cholesterol basically improves. Like I mentioned before, your bone density improves as well. There is good evidence that osteoporosis can actually reverse to become normal or at least osteopenic.
Right. So certainly for anyone and everyone listening, especially the aunties and uncles, right? Don't be afraid of exercise. Yes, injury risk is real, but if you are careful, you do it correctly, and you seek out medical support, the chances of you doing it successfully is really high. You will need to benefit yourself by changing some of your dietary behaviors, enhancing it here and there, but ultimately you will see massive shifts in your health as you age. When it comes to frailty today, really, it's no longer a mandatory sentence for all of us. There's a lot of things you can do. Get yourself screened, get yourself checked out, know your baseline, and work with medical support, medical professionals to help you get started. Pair that up with good nutrition, good lifestyle behavior changes, and you will see to it that you have a much better functional golden years to come. Thank you for listening, and we'll hope to see you soon.